home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Health Care, where people are the heart of our business. All County Health Care is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
All right. Hello, South Florida and beyond. Welcome to the You and Your Doctor Living a Longer and Healthier Life show. February is American Heart Month, and here we are, February 19th already. Wow, this year's going by quick. So we're going to do a show dedicated to the heart and the latest and greatest in heart care, and that's interventional cardiology. And on the program, we have Dr. Houman Khalili. So without further ado, Dr. Khalili, thanks for joining us this evening. How are you?
Thank you for having me. I'm doing very well. How are you?
Great. Thank you. And thanks for coming along on this adventure of health. So interventional cardiology, I looked this up a few years ago when I first started doing PR. And I know it's the catheter-based treatment of heart disease, but it's really a branch of cardiology that is just thriving, and it seems like every day there's something new going on. So tell us a little bit about your medical specialty, interventional cardiology, and how you got involved with it. This is your life, your dedication.
Yeah, it is. Yeah, so, you know, I can tell a little bit about how I got into it. Like a lot of people, I would say. I went into medical school thinking that I'm going to be doing, I'm going to specialize in cardiac surgery. And, you know, with cardiac surgery, as you know, most people know, they go in, they open up the heart or the chest cavity and do bypass the arteries of the heart or replace valves in the heart. And it's a great field. It's a great field. It's very rewarding. But when I was in med school, I remember I was sitting in a library taking a break between studying for exams, and I just happened to run into this journal. And this was back in like 2004 or so. And I was looking at this journal, reading it, and he was talking about these new technologies that are coming out to, put a new valve in the patient's heart without actually opening the chest cavity, going through the groin or different vessels. And so that way, the patient is not subjected to a big operation. And these were just, articles talking about, maybe they did it one patient here, one patient there. And that fascinated me. And so because of that and a couple of other rotations I had in med school, I decided to, instead of going down the field of cardiac surgery, I was like, you know what? I think this is the future. And I want to be part of that. And that's what happened. I ended up going to cardiology and then subspecializing in interventional cardiology. So
originally you were thinking, your interest was in open heart surgery.
Yeah, absolutely.
But now as things evolved so quickly, some of those procedures are being done interventionally now.
Exactly right.
So this was your opportunity to get involved in a growing field. So how do you access the heart? Or do you go through a specific set of veins in the body, or how does that work? Because we hear interventional and we know it's catheter-based treatment, so it's going to go through a vein or artery.
Right. So we're going through all sorts of different avenues. So most common route, I would say, is we go through the arteries that are in the groin. Those are called femoral arteries, and you have one on each side, the right and left. So we go through either one of those, and we put a plastic tube in through those arteries and go with a catheter all the way to the heart. All the arteries and all the veins eventually find their way back to the heart. So we just follow the anatomy, follow it all the way back, and find our way to the heart. So we go through the groin for certain procedures, for certain other procedures, and this is becoming a lot more popular, particularly amongst patients, is we go through the wrist. We can go through either wrist. We can go through what's called a radial artery, and for certain procedures only, because the artery is pretty small, so we can only fit so much in there. Sometimes we go through the arteries underneath the clavicles for certain procedures. So we find a way. We find a way to the heart, however difficult it may be. But most common, I would say, is the groin and is the wrist.
I'm going to jump around a little bit this evening. So you've found your way down here to South Florida. I know. Tell us a little bit about your education and training, the amount of years, because I know you were talking about that in the green room, and someone was really interested in the amount of years that you went to school, and where you did your medical school internship, residency, and fellowship, because it was all at the same
institution.
Institution.
Yes.
That's great.
So, so I can tell you, it's a long road, it's a long journey, but at the end of it is very rewarding, and it totally becomes worth it. But essentially, you do. In order to become a physician, you have to go through, obviously, 4 years of college. You have to take a certain number of classes, what we call pre-med requisites that you have to take. And after that, then you go to med school. Med school is 4 years. After you do med school, then you decide what specialty you want to go into. And depending on the specialty, for me, I decided to go into internal medicine because I want to do cardiology, and that's the way you get into.
That's the path, yeah.
That's right. So the internal medicine residency is about 3 years. After that, then you go into cardiology fellowship, and cardiology fellowship, depending on where you go, is anywhere between 3 to 4 years. And most of that is clinical. Some of it is research. And then after that, if you're interested in subspecializing further, you can go into intervention cardiology, which is what I do. There is a field called electrophysiology, which they deal with the electrical conduction system of the heart, deal with electro abnormalities, etc. Or you can go into a heart transplant specialty as well. And each one of those is anywhere between 1 to 2 extra years of training. And then after that, if you're interested, you can always do more training.
You're still up for it.
You're still up for it. You're not tired. You can do additional year of training in structural heart disease, which is what I was talking about, replacing valves via catheters. And that is about 1 year. So, you add it all up, and I'm not sure how many years that adds up to, but somewhere in the ballpark of 14, 15 years.
14, 15 years, yeah.
Yeah, and I happen to do, I did most of my training at University of Texas Southwestern in Dallas.
Which is a fantastic heart institute.
Is very well recognized.
Very well known. I know there's a lot of physicians just here in South Florida with Tenet.
That's right.
That are from
That's
there.
right. A couple of them I know very closely.
Yeah.
I did training with them. And then after that, I did my structural heart training, specialty training, actually up in very well-known institute, William Beaumont Hospital up in Michigan.
Oh, wow.
Yeah.
Way up in Michigan.
Way up in Michigan.
You had to go through a couple of those winters, huh?
Yeah, and I came immediately back down to South.
Yeah. Right back down to South.
Right.
To the Texas and South Florida.
That's right.
As well. So we're here with Dr. Houman Khalili. He's new to this area. You started a month ago? Has it been a month now?
About.
Okay. And you're an interventional cardiologist with Tenet Florida Cardiovascular Care in Fort Lauderdale. Right there, right off Broward Boulevard. It's 2307 West Broward Boulevard, Suite 101, Fort Lauderdale. That's right near I-95.
Yes. It's very easy access. You just get off the freeway and...
I think it's the first right.
That's right.
Yeah, once you get off.
Yeah, that's right. Yeah.
So as you're heading westbound there on Broward Boulevard, it's the first right off of I-95. The number's 954-523-3422. I'm lucky to have you on the program for February is American Heart Month.
That's right.
So we're bringing awareness to the signs and symptoms of heart disease and, bringing the greatest doctors around on the program. And for 2, this is a good opportunity to talk to you because I have a feeling you're going to get very busy as your roots get planted here in South Florida because you're one of a group of specialists in the last few years that Tenet Health has brought to South Florida that are structural heart disease cardiologists. I've had one on the program. I actually worked on a testimonial recently for another one of them, and I think you're the third that I know of. That so that's great. So I mean, Tenet's bringing some really big players in, heart care to South Florida. Now you have a ton of areas of interest. So we talked a little bit about interventional cardiology.
Right.
We're going to talk briefly about transcatheter valve interventions, complex coronary interventions, hypertrophic cardiomyopathy, transcatheter left atrial appendage closure. Your toolbox, you have a lot of tools in your toolbox. Percutaneous ventricular assist device, and I know you're very in tune with cardiovascular research as well. And something I want to get towards the end of the program: transcatheter paravalvular leak closure. So those are Dr. Khalili's areas of interest. How does it work if I think something may be wrong, going on with my heart, or family or friend member? Do I call your office directly, or do I need a referral to see you?
You can call my office directly.
Okay.
Yes, you can call my office directly, and we make an appointment as quick as possible, and I'll be happy to see anybody.
And that's 954-523-3422. And I know Dr. Khalili, Tenet Florida Cardiovascular Care, they can also answer any questions anyone has about insurance, Medicare, Medicaid, that kind of thing.
That's right.
So I know you're set up for that as well. What age range of patients does a interventional cardiologist see?
18 and above.
18 and above. So adult,
essentially adults, yeah. We don't deal with pediatric cardiac issues. Pediatric cardiac cardiologists see patients who have congenital cardiac problems, and those are very unique to that population that we don't dealt with a whole lot. So 18 and above is usually what we deal with.
Okay, I don't want to get too much into structural heart disease because we're taking a break in about a minute, but
Gotcha.
let's start a quick one on hypertrophic cardiomyopathy.
Right.
I mentioned that. What is that?
So it's the most common genetic abnormality of the heart, and it's what we call the most common genetic cardiomyopathy, and it's the most common genetic cause of patients dying from sudden cardiac death. So you hear of athletes, football players or soccer players in Europe, in the middle of the field,
Just
dropping and
unfortunately
dying.
dropping dead.
Those patients, most of them are dying from hypertrophic cardiomyopathy. And a lot of times it can be asymptomatic, and the first presentation could be, unfortunately, sudden cardiac death. Sometimes they present with shortness of breath and chest pain, and so that's very important to catch it early on. And there are therapies that we can offer these patients to improve their symptoms, and there are preventive strategies we can utilize to prevent potential events of sudden cardiac death.
And get that person to a hospital, because that's where interventional
Exactly
cardiologists are right now.
Yes.
Not an urgent care. That's something like you have heart issues, get that person to a hospital.
That's exactly right.
I don't want to get too much into it. We're going to take a quick break with Dr. Khalili. On the other half, talk about structural heart disease on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 20
They're 954-523-3422, or check them out on TFPS Docs. That's TFPSDOCS.com. He's got all of his information is up there with the Tenet Florida Physician Services website there. We talked a little bit already about interventional cardiology, hypertrophic cardiomyopathy. Thanks for such a brief. I really appreciate that.
Yeah, sure.
Trying to get everything in here. Absolutely. And I want to talk a little bit more about structural heart disease. Now, who gets it? Is there a certain age? Is it men and women, or certain ethnic groups more prone?
Not necessarily ethnic groups, but definitely more men get it than women. But not that women don't have valvular problems, but it does impact more population of men than it does women. But certainly, I don't want to underestimate the amount of the number of women who are also impacted by structural heart disorders. And when we talk about structural heart disease, we're talking about aortic valve issues, mitral valve issues, and these are valves that are separating the chambers of the heart. And the heart has 4 chambers that the blood goes from one chamber to the other, goes to the lungs. Lungs oxygenate the blood, goes back to the heart. From the top chamber of the heart, goes back to the bottom chamber of the heart, which is called the left ventricle. This is a really muscular chamber of the heart. Is strong enough to pump the blood through the aortic valve into the body, into the aorta, and delivers oxygen-rich blood to the brain and vital organs, and keep it going. And so as you can imagine, the heart is pumping all throughout your life. These valves are opening and closing and opening and closing, so they go through a lot of wear and tear. And eventually, what happens is it can start wearing off, and the valve is not functioning properly anymore. So in the case of aortic valve, the most common pathology that happens to the valve, aortic valve, is instead of opening all the way up, very nice and open, it doesn't. It opens up a little bit and then closes back down. So if it only opens up just a little bit, there is not enough opening for all the blood to get out. So that bottom left ventricle of the heart is trying to push that blood through this narrow orifice, and it's having a hard time, because there's not enough opening. So the heart starts getting thicker and thicker, and eventually this blood's the pressure builds up. The pressure builds up, it backs up into the lungs, and what ends up happening is people come in, they're feeling short of breath, they have chest pain, and they can even present with passing out, what we call syncope, so blacking out, and that's a worrisome finding. Because if this goes untreated, not only patient has worsening what we call heart failure and shortness of breath and fluid building up in your legs, but they can eventually die. And 50% of patients who have this problem with aortic valve and have symptoms in about 2-3 years, without getting treated, they end up succumbing to it. They end up dying. So this needs to get fixed. And the way that we fix it is get the valve replaced. Surgeons can go in and completely replace the valve, but unfortunately, some patients, they are just not candidates for surgery because they have a lot of issues, or it's other medical problems, or the problem has gone on so long that their heart is just weak to tolerate surgery. And so for those patients, what we can offer, it used to be that they didn't offer them anything. And what we can offer now is what I talked about, is deliver a valve, actually, through a catheter, and we do it through the groin or different routes, but most commonly through the groin. That amazes me. That still amazes me. And deliver all the way up to the heart, and put a new valve in the position of the
so it inserts right out of the catheter, and
it's exactly
once you get into the spot there, Dr. Khalili, and you just all right, here we go.
Yeah, exactly,
and
right.
Just like that, that's right exactly into the valve.
Yeah,
unbelievable.
Exactly right. Yeah, I actually was in a case this morning with Dr. Maney, as you got.
That's what I was alluding to before.
Yes, at the Delray Medical Center.
Dr. Bridge Maney.
Yeah, and at Delray Medical Center, and it still amazes me. Procedures, we've gotten very, very good at it. We're doing it very quickly, and patients nowadays tolerate the procedure very well. It takes less than an hour for us to do, which is amazing, and the hospitalization afterwards, its average is about a day or two in the hospital, and you go home.
Yeah, and
and compared to, let's say, open heart surgery, where you have to spend a few more days in the hospital to recover and recuperate for a few months afterwards.
That is just amazing. We're here with Dr. Houman, Khalili, interventional cardiologist, Tenant Florida Cardiovascular Care in Fort Lauderdale, 954-523-3422, tfpsdocs.com. We have a few more minutes, so I'm going to ask you a couple more questions to go a little more in depth and some of these transcatheter valve interventions. So you do the TAVR?
Yes.
Okay.
Right. Yes.
So that's transcatheter aortic
valve replacement. Yeah.
Oh,
so
yeah.
That's
Thank
the
you
one
for saving me there.
So that's the one I was talking to you about right now. Is delivering a valve into the aortic position. But there are since TAVR came about, and it's been around for about 19, 20 years, and approved by the FDA in about 2011, if I'm not mistaken. There have been other technologies that are coming through the pipeline. There is a technology for a mitral valve. So we go in and actually fix the mitral valve. We repair it. We go in, and the mitral valve, let me just back up a little bit. Mitral valve is the valve that separates the top chamber of the heart from the bottom chamber of the heart on the left side. So the left, what we call the left atrium, which is a conduit that receives all the oxygen in the blood from the lungs. And that blood goes through the mitral valve to the bottom, the left ventricle, which I just talked about. And this valve, the most common thing that happens to that valve, unlike the aortic valve, is it becomes leaky. So it opens up fine, but then when it closes, instead of closing, not allowing the blood to go back, it actually doesn't close all the way. One of the leaflets is kind of leaking, and the blood can gush back. So you can imagine if the blood goes back in here, it can kind of increase the pressure and go back into the lungs, and kind of similar issue happens. Patients get short of breath. They can end up accumulating fluid and volume in their body. So this is a pretty common valve abnormality. The way to fix this is, again, to get that valve replaced. Unfortunately, again, there are patients who are not candidates for surgery due to a number of issues, and there's a lot of them who are like that. In tradition, what we used to do is just treat them with medications. And unfortunately, that didn't work great for a lot of these patients. They kept having shortness of breath or coming to the hospital. But we can go with catheters nowadays. With a catheter, we go in. The technology is called MitraClip. With a catheter, we go in. Essentially what it is, it's a clip. And we grab on the tips of the leaflets that's going back, and we grab it and bring the tip of the leaflets together. So that way, the valve is no longer what we call flailing or prolapsing. And so blood cannot gush back, cannot leak back. And that has been shown to be very effective.
And then you don't have that regurgitation, that Scrabble word. This is mitral valve regurgitation?
Exactly. And the way we do that procedure is very similar. We go through the groin and do it through the groin.
In an hour, it's done.
It's exactly right.
And they start their recovery.
Exactly. They go home the next day.
Yeah, and I've talked to a couple of these patients, and they tell me, David, it's not even a pinprick. I didn't even feel anything, to be honest with you, because you do a little local there.
Yes. As
well. So that's amazing. Tell us a little bit about transcatheter left atrial appendage closure, because that's different, right?
That's very different from these valve technologies. So we're not fixing a valve with this one. So there's a condition, as you might have heard about, atrial fibrillation. So that's irregular heart rhythm. And the usual electrical activity of the heart comes from the top chamber of the heart, goes down the ventricles, and that's how the electrical activity kind of propagates down. The top chamber is beat, the bottom chamber is beat. The top chamber is beat, the bottom chamber is beat. In irregular heart rhythm, which is the most common electrical abnormality of the heart, the top chamber electrical activity is not right. So instead of all of them beating at the same time, the top chambers start quivering. So there's quivering of the top chambers of the heart. The bottom chamber works fine, but the top chamber quivers. When that happens, blood, instead of kind of going through the heart in this continuous motion, blood can stagnate. And when blood stagnates in the heart, then it can start forming clots. So that's why patients with regular heart rhythm or atrial fibrillation are at an increased risk of stroke. So for a lot of these patients, what we do, we have them on blood thinners. And we have them on blood thinners. Unfortunately, the downside of blood thinners is patients can bleed, right? You reduce the risk of stroke, but they can bleed in their heads, they can bleed from their GI tract, the gastrointestinal tract. So for those patients, there used to be no alternatives. We took them off blood thinners, and they were at increased risk of stroke. But now what we can do is go with a catheter and go to that tiny chamber of the heart. We call that left atrial appendage where the clots form and plug it up with a plug. And when we put a plug in there, the clot can no longer form in there. And it's been shown that if you do that, we reduce the risk of stroke just as good as a blood thinner without subjecting the patient to an increased risk of bleeding.
Wow, the Watchman device?
The Watchman device,
All
that's right.
I did my homework, Dr.
You
Khalili.
did, yeah.
We have like about a minute. So Dr. Houman Khalili, interventional cardiologist, 2307 West Broward Boulevard, Suite 101 in Fort Lauderdale, 954-523-3422, tfpsdocs.com. I didn't get to transcatheter paravalvular leak closure, but people can look it up. And,
absolutely.
You know, if they have any questions, call your office. That's a good opportunity to have you back on the show in the future.
Yeah.
But I want to thank you. You taught us a lot about the heart. February is American Heart Month, and you're always welcome back on the program.
Thank
and good luck in South Florida.
Thank you very much.
Like
Thanks
so
for
far?
having me. Great. It's been great. Nice and sunny.
Good to hear. We'll ask you next time on the You and Your Doctor show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.